from freehelpforcancer.com. I got into cancer and answers for cancer when my 7-year-old daughter was diagnosed with leukemia. The treatment is 2.5 years long, and this is how I learned all the things that I do videos on telling you about. We were forced by necessity to figure these things out, and I realized that I wanted to help other people get these same answers. Okay, now, neuropathy. It is one of the most common diseases affecting upwards of 20 million people. Symptoms are numbness, pain, weakness, incoordination, and it is a result of damage to the nerves. During treatment, my daughter had severe neuropathy. It started off as muscle cramps in her legs, and it eventually became nerve pain in her feet, and it was so bad that she didn't want to walk. Okay, so the only option that our doctors offered us is a drug called Neurontin. It's actually an anti-seizure medication, but it was accidentally found that it works for patients that have neuropathy in their peripheral neuropathy, feet, hands, but it can show up in your jaw. It can show up all over the place. Now, Neurontin does work. Kayla had to take it 3 times a day. It seemed to be a pretty high dose. Eventually, I found other answers, and here are the answers I'm going to tell you. Magnesium is the 4th most abundant mineral in the body. It is needed for more than 300 chemical reactions in the body. You can find this on the National Institutes of Health website. You just type in magnesium supplement facts when you get to that website. Magnesium deficiency symptoms are very similar to neuropathy symptoms such as numbness, tingling, muscle cramps, etc. Some medications may result in magnesium deficiency. So the chemo that Kayla got that caused the neuropathy was called vincristine, but I believe other chemotherapy drugs can cause the same reaction. Okay, so let me tell you about magnesium. First off, calcium and magnesium work together. They should not be taken without the other half of it. Calcium should be, let's say you're taking 1,000 milligrams of calcium a day. It's 2 to 1 calcium to magnesium, so it would be 1,000 milligrams calcium, 500 milligrams magnesium to get the right amount. I have several products to show you. This is full spectrum minerals, and I believe 2 capsules. You get 1,000 milligrams of calcium and a couple 100 magnesium. This is another product, calcium and magnesium, put out by Vitamin World. Kayla took this every day for almost 2 years during her treatment. It's a liquid, so it's not bad. The only problem is this can be binding, and if you're taking chemo, you could already get constipated, so you have to watch that. You might have to take fiber to make sure your bowels are going frequently. Let's see. Now, B12 helps maintain healthy nerve cells in the body. So, B12 we used also for neuropathy. You can get this at CVS. You want the sublingual. It tastes good. It melts under the tongue. The next tip, this is an unusual tip, and you should go to my website because I have the full article on my website. It's called Neuropathy/Muscle Cramps. You can print out the document, bring it to your doctor for approval, see what they say is okay for you to take. But it has all the medical quotes on it, and that's what your doctor needs. Okay, the next wild tip. This is a sponge. I was told by a Chinese doctor that when the nerves are damaged, let's say you have neuropathy in your hands, he said to use this sponge many times a day in an upward motion, and it helps the nerves. It sounds crazy, but Kayla would do her feet many times a day, going up the bottom of the foot like this, and up this way, up her leg, and it did help. We kept that up for months until she was, until the vincristine was lowered. So that's another kooky trick. It's a dry sponge. We like the large size. Give it a try. You've got nothing to lose. Okay, thank you very much. Good luck to you. I hope you find this information helpful. Bye-bye.